Hello, welcome to This Week in Medicine. It was March 21st yesterday, but we had audio difficulties. So it's March 22nd today, but pretend like this is March 21st, This Week in Medicine. Brought to you by the Foxhall Foundation. Here's Dr. Yamamoto on the education mission last week, doing a talk at a National Physicians Education meeting. Still working on the education mission, We have our Foxhall Wellness Center, Imbalanced Nutrition, PLLC with Carrie is doing great. Thank you, Carrie, for all your hard work. Hopefully some new classes coming. We're working on it, but still we have Key Active Masters, which meets a couple of days a week. Look at our website for Kenzen-Do Karate and you will see Key Active Masters. This is our Wellness Center, Foxhall Foundation. So what was in the inbox this week? Well, a lot of when can I get a fourth shot? The meeting for the fourth shot discussion will be April 6th, and it's probably more than just a shot discussion. This is intended to be a strategy planning meeting about vaccines. Where are we with the pandemic? Should we be doing an Omicron specific vaccine? Right now, there is no recommendation for a fourth shot unless you are immunocompromised, and that doesn't mean over 65. There's really not good data suggesting that a fourth shot of the original mRNA vaccine against COVID-19 is beneficial in protecting against infection or hospitalization or death with current Omicron strains, especially the BA.2. So we don't know yet that a fourth shot is actually beneficial, and right now the data is looking fairly weak. Should I get a fourth shot before I travel? A lot of people are traveling out of the country. I can't really answer that question for you. It could be for specific individuals, especially the immunocompromised. That's an easier question to answer. But again, being over 65 is not what we mean by immunocompromised. To mask or not to mask, again, let's all respect each other and our wishes to mask. Some people are getting chemotherapy. Some people did not get good antibody responses to vaccines. Some people didn't vaccinate. So it's a personal decision to mask. Respect those who still choose to. I know there are a lot of people taking off their masks, but even today I saw 2 patients positive for COVID listed on the emergency room census. So people are still getting COVID. Again, do I need a fourth shot? Got another email on that. When is my colonoscopy due? Because March is Colon Cancer Awareness Month. I just answered that question for a family member. Yes, try to get your colonoscopy scheduled this March, or if you're a candidate, do Cologuard. And this was a great one that came a couple days ago. I just attended a wedding with 200 people and my cold won't go. Well, maybe your cold won't go because it's not a cold. And we'll talk about that a little bit more. Do you even have a cold, or is your cold actually Omicron BA.2? Could be. And then the big question that inspired me, that pulled me back in like Michael Corleone, was the Hong Kong issue. I was going to take a break this week as another group of physicians in town is taking a break from their weekly advisories. I thought, well, maybe we can cool down a little bit on the Omicron advisories, but then Hong Kong came into the news, and it's really hard to resist talking about Hong Kong because the experience there is an amazing public health experiment in COVID. So we'll get to that in a minute. So a fourth shot with mRNA, there was a New England Journal of Medical article that came out giving this fourth shot to healthcare workers. It did not look beneficial in protection against Omicron BA.2, and it didn't really look beneficial overall. The booster response really wasn't significant. It looks like the third shot's good enough. So this wasn't in people over 65, and that's what everybody's concerned about. And rightfully so, if you look at the death rate in Hong Kong for the over 65. But again, we'll get to that. They weren't vaccinated. Pfizer submitted a request for people over 65 to get a fourth shot. Moderna submitted a request for everybody to get one. That will be reviewed. Also, there was a Moderna Omicron specific booster that doesn't look like maybe it worked very well against Omicron, so we have to see that data come out. There's speculation that maybe it's not good. Do we have enough immunity even from December and January with the first Omicron to prevent BA.2 right now? We might. It's close enough to, at least in our area, the huge amounts of infection from Omicron that people might still have retained some immunity to Omicron just based on infection rates from November, December, January, because we had so much Omicron infection here. We might not actually be susceptible to the other variant right now. This might keep our levels low, at least in our area. Don't know. It's going to be different throughout the country. In my unscientific study of antibody levels in my patients who are over 65, who got a third shot, I've done some antibody testing in these patients, and they're still dramatically high. And this is even for people who got a booster shot early, like September or October. I have not seen anybody with low antibody levels after a third shot, except for those who have are on chemotherapy or immunocompromised. So far, my unscientific, meaning I didn't randomize or blind this, I just offered to do antibody testing for people if they were curious if they still had antibody response. Looked great. Again, might these original COVID-19 vaccines not induce good immunity against Omicron? It's possible because a lot of patients got Omicron infection in my patient population, November and December, and they were pretty much all boosted with a third shot, yet they still got Omicron. So clearly it doesn't protect against infection. It prevents against severity. Again, we'll see that with Hong Kong. So from my inbox, I went to a wedding with 200 people. I've had a fever, sore throat, body aches, congestion for 10 days, and done 6 COVID tests, both antigen and PCR. They're all negative. This very good patient called me and told me this, and she stayed at home. It is very likely that she actually does have Omicron infection. More and more patients have classic symptoms of COVID Omicron infection. These ones, the fever, the sore throat, the body aches, and congestion, and yet their testing is all negative. Is it possible that our antigen tests and our PCR tests are not actually picking up the Omicron variants now? I think it's very possible. So like we would with Omicron, try to wear a mask, try not to be around people for days number 5 through 10 in your illness. But this ushers in a new idea, perhaps, in respiratory infection disease prevention, which is maybe our current and future scenario should stay. Maybe if you're sick, your COVID test is negative, but you know you have a respiratory illness. Maybe you're a good citizen, friend, and colleague because I'm going to wear my mask anyway. My test is negative. Maybe my test is faulty, but I know I have a respiratory infection. And the last thing I want to do is confuse the population of people around me by giving them this infection and spreading it. Even if it's not Omicron, it's still a febrile respiratory infection. And we don't want to give those to people. So wearing a mask is a good idea. Keeping your social interactions low is a good idea. Maybe this was a lesson. Maybe this is a silver lining from COVID that we all learn to respect each other's breathing space and wear a mask when you're sick and keep your social interactions down when you are sick. So what is going on with Hong Kong, which truly drove me to do this presentation this week? Their mitigation strategy was that they strictly isolated people, not just 10 days, but if you were sick, you were 3 weeks. So they were very tight on isolation, physical isolation. Unfortunately, as tight as they have been the past 2 years, they have not had significant COVID outbreaks at all, and their death rate has been extremely low. Older age patients did not get vaccinated. Was it because they didn't have mRNA vaccine? One of their vaccines was inactivated Sinovac. They did have a BioNTech mRNA vaccine, so not everybody got mRNA. But unfortunately, when the vaccine data came out, social media suggested to the community in Hong Kong that this was a dangerous vaccine. Therefore, that led to people not getting it. In particular, less than 50% are vaccinated over age 70 in Hong Kong. That is a scary figure. It's not a figure we have in the United States. Our over 65 crowd definitely is vaccinated at a higher percentage rate. This death rate right now in Hong Kong for the past 4 to 6 weeks is the highest death toll at any time in the pandemic. And it is largely due to lack of vaccination in the most susceptible population, which is over 70. Half of the population has been infected in the past couple of weeks. There are 7.5 million people. Half of them, about, have been infected. That is very dramatic. This is in a population where everyone wears masks. This is a great article that I got the data from by one of my favorite sources, which would be a doctor on the ground. So this is not somebody I know specifically, but you can tell just reading this article that this doctor knows what they're talking about. Dr. Sridhar, who is a virologist, expert in viruses, and at the University of Hong Kong, and practicing, he says in the article, in Hong Kong for 10 years. So he did a guest essay in the New York Times on March 18th, so a couple of days ago. It's just a great article, easy to read, incredibly useful information. So I recommend, if you can look this up, if you have a New York Times subscription, read this guest essay. This is where I got the information about the Hong Kong outbreak. Also, New Zealand had an outbreak. This is a tweet that's been going around. It shows the power of vaccination. This is Hong Kong. In red is the death rate. This is New Zealand. In red, you can barely see it, is a tiny sliver of the death rate. 2% are unvaccinated in New Zealand. 66% of the over 80 are unvaccinated when Omicron took off in Hong Kong. This accounts for their very high death rate. Vaccination works. It saves people's lives, especially over 65. So if we didn't appreciate that in the United States, this slide should make us appreciate the difference. Vaccinating our senior citizens made the difference clearly between life and death. And it's really sad that social media had such an impact in Hong Kong. They had availability for vaccine. This is obviously a very wealthy and well-established community in Hong Kong, and they should have been able to vaccinate. And unfortunately, they didn't get to it, and so many people died. This slide is great because it shows in New Zealand that did not happen. So what does Hong Kong teach us? The power of social media, the power clearly of vaccination, especially when you compare it to the outbreak in New Zealand. Also the limits of quarantine and isolation, which had been the plan in Hong Kong for the past 2 years. All those lives that were saved for 2 years, many people are dying now, and it's because they weren't vaccinated. There's also a question of whether or not they had any herd immunity in Hong Kong, because there was so little COVID infection to begin with, and so little of the first Omicron wave. There was no natural immunity. We have a lot of natural immunity here in the United States, but we also have vaccination. So when Omicron hit in Hong Kong, these people had virgin immune systems for COVID and Omicron. They had nothing to protect them. So Omicron is not mild. Clearly, just look at the Hong Kong data. But as the author says of the guest essay, its severity is highly contextual. And when you take the context of Hong Kong, it's very clear vaccination is extremely powerful. So if you do know anybody who's over 65, show them that slide, tell them about Hong Kong, because it will save their life. Remember, March is Colon Cancer Awareness Month. There's an increasing frequency of cancer in the 20 to 50 age category, which is stunning. There's been a recent decrease in the age of first colon cancer screening to age 45, not 50. Many unscreened patients. Ask your doctor if you're a candidate for Cologuard. Generally, you are. Family history does not prevent use of Cologuard. Family history only prevents use of Cologuard if you have 2 first-degree relatives under 60 who had colon cancer, or someone in your family has been diagnosed with a colon cancer genetic syndrome, like Lynch syndrome or non-hereditary polyposis colon cancer. If you've ever had a colonoscopy and had a precancerous polyp, you also can't do Cologuard. But otherwise, there are a lot of people who could be doing Cologuard, especially people at 45 years old. It's an easy test. We use the colonoscopy to clip out the polyps. You don't have to use a colonoscopy to screen for polyps because Cologuard uses DNA to screen for polyps. But ultimately, the only way to get the polyp out is to clip it out. Again, Cologuard only if you've never had a precancerous polyp, or if you don't have family history. Tony's tip of the week, make sure you have your current pharmacy on file with us. If you've changed your pharmacy, if you have a different pharmacy, I apologize to the patient this week who had a different pharmacy she wanted to use for her prescription. We hadn't changed your pharmacy on file, so let us know if you've changed. Also, let us know if you're using a mail order pharmacy. A lot of insurances right now are preventing you from using a private pharmacy or an independent pharmacy, saying that they will not pay for the prescriptions unless you use one of the major pharmacies like CVS or Walgreens. This is coming from your insurance. Insurance plans are doing this. We don't like it, you don't like it, but we're stuck with it. So again, make sure we have whether or not you want a mail order pharmacy and what your local pharmacy would be for quick emergency prescriptions that you don't have time to wait for through the mail. Also, if you want us to use an out-of-town pharmacy, and you're using email to communicate with us, please put it in bold so we make sure that we don't send your prescription to your local pharmacy when you're out of town. So the fast pitch, Again, March is Colon Cancer Awareness Month. Are you up to date with your colonoscopy? Do you know anybody who is 45 years old? Because insurance universally is covering Cologuard now. So inability to pay is not a reason to not do Cologuard. Some people still need to wear masks, so we're all going to respect those people and respect those individual decisions. And furthermore, if you think you're sick and your Omicron test is negative, you still don't want to pass a respiratory illness. So wearing a mask and decreasing your social interactions is not only courteous to others, but it definitely controls infection. Update your preferred pharmacy, and remember, there's no recommendation for a fourth shot yet. More strategic planning, hopefully broader discussion of the place of vaccination and what we're doing with this virus will happen on April 6th. Don't expect any quick answers, though. This is a complicated issue. At least everyone should have vaccinated with the mRNA vaccines. So if we could get the rest of the population who's unvaccinated vaccinated, that would probably be the most strategic way to deal with this. Remember to address the aspects of your healthcare through the healthcare pyramid. Make sure all of these things are addressed. You can prevent a stroke, is still available. Remember, vascular disease isn't really disease, it's aging. We're all going to age in our arteries. Our hearts all age. We all have our own independent pattern of aging, and that usually can be addressed with your doctor. Again, subscribe and hit like. If you have a Google account, then this will come to your Google account. If you don't, that's okay. We're still sending out emails. Thank you very much for watching. And again, we're going to try to decrease the frequency of these, provided that Omicron and COVID don't keep throwing us curveballs on the fast pitch. Thank you.